Professional athletes are prone to a torn meniscus, which is due to traumatic injury when the knee joint is bent and then twisted. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about torn meniscus injuries.
A meniscus tear is a tear of one of the two types of cartilage in the knee. This is the cartilage that is commonly referred to as a shock absorber. Meniscus tears occur typically with twisting injuries. Sometimes it is associated with ligament injuries, more commonly the ACL. The symptoms of a meniscus tear include pain, most commonly located at the side of the joint where the meniscus is. Often patients will also notice swelling, stiffness, clicking, popping, grinding sensation, and on occasion patients will complain about instability of the knee as if it were buckling or giving way. If the tear is more on the periphery of the meniscus, sometimes these will heal. Typically the tears that involve the inner side do not heal, and they have a higher chance of requiring surgery.
You have to have surgery most of the time with a meniscus tear because it doesn't heal on its own. So the surgeon sews it back to the bone, and then it's up to the rehabilitation specialist to get you back. Some of the simple things that you're going to try to get accomplished with that is to reduce the swelling from the surgery and reduce the pain, and then start to mainly get into strengthening exercise. That's the most important thing. The strengthening exercises to the quads and the hamstrings, leg presses, which is closed chain, and then leg extensions, open chain, hamstring curls. Those are all basic exercises you can do in any gym. The other thing is to strengthen the hip muscles, the deep external rotators and the hip abductors. We have a demonstration of both of those exercises, and we're going to go to those videos right now. This is an easy exercise really to do, and he's going to be, again, 90-90, so the hip is at 90, the knee is at 90. And again, if you are really weak, you won't even be able to put a weight on the end of this ankle, but he's going to bring it down as low as he possibly can, and then he's going to come straight up, Chris, as high as you possibly can, right? You want to avoid trying to bend the knee because we don't want to get the hamstrings involved. We want the deep hip rotators. Find a weight that you can only do 6 or 8 reps with and 3 sets. Work up to 12 reps, 3 sets, or 15 max reps, 3 sets, and then drop back down to 6 or 8 and add more weight to continually stimulate that muscle to grow. The hip extensors and the hip abductors, and Chris is going to get both with this exercise. As you can see, he goes back into extension and then lifts his leg up. And then you just take a weight again, put it around your ankle, and he's going to slowly lower it down, right, to the count of 10, and then come on back up again. Again, you find a weight you can only do 6 or 8 times, a couple of sets. You work up to 12, 15 max reps, 3 sets. Then the muscle is strong enough that you can add more weight. Drop back down to 6 or 8 and add more weight and progress that way, constantly stimulating the muscle to grow.
Keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.